If you've got shoulder pain, you probably know that the common treatments such as exercises, medication and other therapies don't do much more than temporarily relieve the pain. And doctors and therapists will sound very confident giving you a diagnosis and advice, but the reality is that the clinical trial results for those treatments are not exactly encouraging. And according to a recent medical journal review of shoulder pain therapy, there's no agreement amongst them on how to control your pain or any type of exercise to correct the problems. Well, that's the bad news, but there's light at the end of the tunnel. Now, scientists have worked out why you get shoulder pain and what needs to be done. Unfortunately, that information doesn't get passed on to doctors. What happens is the medical journals get to filter out what the doctors read. Now, when they choose what research and information to publish, sometimes they have to choose between publishing valuable information that will help people like us, or appeasing drug companies that pay them millions of dollars in advertising. That's why doctors are never told about a lot of things. And in the case of shoulder pain, it's the two main easily treatable causes of shoulder pain and the fact that there's no way in the world the exercises they prescribe can fix the problem. The good news is that the solution to a lot of shoulder problems is often just to simply address those two causes that get overlooked and to stop doing those exercises and therapies that don't work. Now, in working out what you need for this video, I'll have to consider that although these common causes are not being addressed, there are genuine issues that sometimes need medical attention. Also, usually the best way to deal with these problems is to get professional advice but be able to supplement their care with things you can do yourself. With this in mind, I'll do two things. Now, the first is give you comprehensive yet easy to understand general information about these issues so you can choose a professional and discuss your care in an informed manner. Now, the second is to give you home advice that I'd give a patient if it were appropriate. Also, to keep this video on point, I'll just give you the facts and link the details and references in the description. The first cause of shoulder pain that gets admitted is having head and shoulders forward posture like in this pic. It's very common, very obvious, and I found 7 studies that confirm it, yet no mention in the medical journals. Now, there's a couple of ways that this causes shoulder pain. The first is that your head and shoulders are designed to sit nicely balanced, but with your head and shoulders forward, they're no longer balanced. Now, if you check out this well-known building in Italy, because it's leaning, it wants to fall over, so they had to do a lot of reinforcements. Now, it's the same with the head and shoulders forward posture. It causes extra tension in muscles and pressure on the joints. The other way head and shoulder forward posture causes shoulder pain is that because your arms hang straight down, as this diagram shows, it alters the angles of your shoulder joint. Now, to show you how badly this affects things, we'll do a simple demo. Now, first I'll get you to sit up nice and straight and then bring your arms up to your side. They should be able to move freely all the way to the top. Now I'll get you to lean forward like you've got head and shoulders forward posture and do the same thing. Now, your shoulders will only move about half as far before things start to jam together. Now, one of the main diagnoses medical doctors make for shoulder pain is shoulder impingement, which means the joint is moving abnormally, causing it to pinch. Now, what I've just done with the demonstration is to take perfectly good shoulder joints and make them pinch. Now, if I walked around with my head and shoulders forward, it would continue to do that. I would get sore, and the doctor would diagnose it as shoulder impingement syndrome. Now, I mentioned before how shoulder exercises can't fix these problems. Now, let's say Mr. GP's been diligently reading the medical journals and prescribes me shoulder exercises. Each time I do the exercises, it's just going to pinch more. Wouldn't it be a lot more sensible just to straighten the posture up? In saying that, in one trial, that's exactly what they did. Now, scientists used tape to straighten the posture and the sore shoulders got better. Now, it's okay in a trial to prove the point, but taping's not a long-term solution. Now, how you straighten your posture properly is way too much to cover here, so I've linked it in the description. Now, the next overlooked cause of shoulder pain is myofascial trigger points, which are those tender lumps in your muscles that therapists find. Now these are really common. Studies show that even in adults without shoulder pain, about 90% have them sitting there waiting to fire up. Now, a bunch of very respected PhD type scientists have done trials showing that they cause shoulder pain and that treating them stops the pain. But you can't treat them with drugs, so we can't have the doctors finding out about them, can we? Now, there are two ways trigger points can cause shoulder pain. Now, the first is simple. You may have seen charts like these before. They show where trigger points refer pain to. Now, one team of researchers investigated the muscles and found trigger points in 17 different muscles commonly refer pain to your shoulder. The second way trigger points cause shoulder pain is indirectly by altering the way your shoulder joint moves, just like the head forward posture did. Now, the key issue is that your shoulder joint has a ball sitting in a fairly shallow dish like this. If not for the muscles, you'll be free to flop around. Now, if your arm moves from the side to above like it did before, it needs coordinated pull from the muscles to keep it sitting where it should. Now, what happens is when your muscles have trigger points, they don't work properly. So that movement becomes uncoordinated and the joint can potentially flop around and injure itself. A few years ago, a scientist doing a PhD at the university I studied at did a study where she hooked up the shoulder muscles to electrodes to monitor them. She found that when they had trigger points, they were way out of sync. But as soon as the trigger points were treated, they all went back to normal. One thing she stressed though was that she used dry needles to treat the trigger points, but the effects would only likely be temporary. As I said before, 90% of people without shoulder pain have trigger points in their shoulders, so if you have shoulder pain, it's a pretty safe bet that you'll have them. Now, just like with the posture, dealing with trigger points is too much to cover here, so I'll link the guides in the description. So in summary, if you've got shoulder pain, these will probably be big issues for you, especially if you've had the medications and therapies that haven't fixed the problem. If you've got problems, I want you to get the best possible care and fixed properly. Now, arm yourself with this info and find a professional that deals with this sort of thing. Now, that may be a chiropractor, osteopath, or a therapist with appropriate postgraduate qualifications. You're now in a position to work with them in an informed manner, and you've also got, for want of a better way of describing it, a BS sieve. If you get the "you've got impingement syndromes, take drugs and do exercises," you can thank them kindly and say next. Anyway, thanks very much for watching. It has been most appreciated.